Let's talk about a number that quietly shapes your future health more than almost anything else your doctor could test for. Yet most people either haven't heard of it or don't fully grasp what it's telling them. That number is your average blood sugar marker, often measured over a 3-month window, and it's one of the strongest predictors we have of what's coming down the road for you medically. And this isn't just about blood sugar disorders in isolation. We're talking about heart disease, kidney decline, nerve damage, stroke, cognitive decline, and even certain cancers. What makes this particular number so quietly dangerous is that you can feel perfectly fine while it drifts upward in the background. There's no pain, no obvious signal, just your internal chemistry shifting in a direction you can't feel happening. Having spent close to a decade working in fast-paced hospital emergency settings, I noticed something early in my career. Metabolic illness almost never shows up out of nowhere. When a patient arrives with their first major complication, kidney failure, a heart attack in their early 50s, a stroke, a wound that simply won't heal, that moment isn't the beginning of the problem. It's the final chapter of something that had been building for years, sometimes decades. The marker had been rising the whole time. Nobody happened to be watching. So today I want to walk you through 15 ways, all grounded in solid research, to bring this number down. Some of these are major levers, changes that move the needle in a big way. Others are smaller refinements. But here's the key idea. None of these work in isolation. They stack. They reinforce one another. If you took all 15 seriously, held everything else steady, and rechecked this number in about 3 months, which happens to be the exact clinical window we use to measure change, I'd wager heavily that your results would improve. But first, a quick explanation of what's actually being measured, because it makes everything that follows click into place. Inside your red blood cells sits a protein responsible for carrying oxygen through your bloodstream. When sugar circulates in your blood, it attaches to that protein in a way that can't be undone. The more sugar floating around over time, the more of that protein ends up coated in it. This test essentially measures what fraction has been affected, and because red blood cells live for roughly 3 months before your body replaces them, the result functions like a rolling 3-month average of your blood sugar. That's precisely what makes it so hard to game with a single good day or a single bad one. Depending on where you live, this gets reported differently, sometimes as a molecular concentration, sometimes as a percentage, but the categories are consistent. A normal range, a pre-diabetic range, and a diabetic range, with your doctor able to tell you exactly where your own number falls. Everything we're about to cover works through one of 2 mechanisms: improving how sensitive your body is to insulin, or reducing how much your blood sugar spikes and lingers throughout the day. Every single intervention on this list pulls one or both of those levers. Let's start with the most obvious one, and arguably one of the most powerful: cutting back on refined carbohydrates and added sugar. White bread, white rice, pastries, sugary cereals, sweetened drinks, and yes, sometimes foods marketed as healthy. These hit your bloodstream fast, triggering sharp glucose spikes. Do that often enough, and your long-term average creeps upward, even if a single fasting blood test looks fine. Liquid sugar is especially sneaky here, since drinking your calories skips the natural signals that would normally slow digestion, sending your blood sugar higher and faster than the same calories eaten as solid food would. This isn't about eliminating carbohydrates altogether. It's about removing the ones that spike you hardest while giving you the least nutritional value in return. Second, increase your fiber intake. Aim somewhere in the range of 30 to 50 grams daily, since most people only get about half that. Fiber slows how quickly carbohydrates are absorbed, forming a kind of gel in your gut that blunts the speed at which sugar enters your bloodstream. That means smaller spikes after meals. It also feeds the bacteria living in your gut, and we now have solid evidence that the makeup of your gut microbiome directly affects how sensitive your body is to insulin. Vegetables, legumes, whole grains, nuts, and seeds are your best sources here. Third, and this one is chronically underrated, protein. Eating protein alongside a meal meaningfully blunts your blood sugar response. It slows how quickly your stomach empties, triggers a more controlled release of insulin, and keeps you fuller for longer, so you naturally eat less overall. There's also compelling research showing that a protein-rich breakfast specifically reduces blood sugar swings for the rest of the day compared to a carbohydrate-heavy one. On top of that, protein helps preserve muscle mass during fat loss, which matters more than most people realize, and I'll circle back to why shortly. In my experience, most people trying to improve their metabolic health are quietly undereating protein without even realizing it. Worth tracking for a few days if you've never checked. Fourth, consider your overall eating pattern. A Mediterranean-style approach has some of the strongest clinical trial evidence behind it for improving blood sugar control. Large-scale research out of Spain, involving thousands of participants, found meaningful cardiovascular and metabolic improvements in people following this pattern. Rich in extra virgin olive oil, vegetables, legumes, fish, and nuts, while minimizing heavily processed food, compared to a standard low-fat diet. What's striking is that these benefits showed up even without aggressive calorie cutting. These people weren't eating less. They were simply eating differently, and food quality alone was doing much of the work. Fifth, weight loss, even modest amounts. Losing somewhere between 5 and 10% of your body weight can produce a significant drop in this marker. The mechanism largely comes down to visceral fat, the fat stored around your internal organs rather than just under your skin. This type of fat is metabolically active in a way that surface fat isn't. It drives inflammation, worsens insulin resistance directly, and increases fat accumulation in the liver, which has major consequences for how your body handles sugar. Landmark research out of the UK following people with type 2 diabetes found that nearly half achieved full remission through sustained dietary weight loss. Not just improvement, but remission. The goal isn't a rapid crash diet. Those rarely produce lasting change. The goal is steady, sustained fat loss, particularly around the midsection. Sixth, and this one is consistently underestimated, resistance training. Your skeletal muscle is the primary site in your body where glucose gets absorbed from the bloodstream. When your muscles contract, they pull in glucose independently of insulin entirely, through a completely separate pathway activated purely by movement. Building and maintaining muscle is one of the most powerful long-term investments you can make in your metabolic health. And we have strong data showing resistance training lowers this marker, even without any accompanying weight loss. A large analysis, pooling dozens of trials, found meaningful improvements from strength training alone. 2 to 4 sessions a week is genuinely enough to see real benefit. You don't need to live in a gym. Seventh, aerobic exercise works through a slightly different route, improving how efficiently your cell's energy factories function, increasing the number of insulin-sensitive receptors on your cells, and improving your body's overall ability to burn glucose as fuel. The benefit here scales with how much you do, though not in a perfectly straight line. And what matters most is consistency. A daily 30-minute walk will outperform a single intense 2-hour session, followed by a week of nothing. If you want to push further, a short walk after each meal does wonders for blood sugar control. Eighth, and closely related, your overall daily movement, sometimes called non-exercise activity, meaning all the energy you burn that isn't formal workout time. Time spent sitting still, independent of how much you exercise, worsens blood sugar control. Someone who exercises for an hour each morning but then sits in a car, at a desk, and on a couch for the rest of the day is still, physiologically speaking, a sedentary person. There's fascinating research showing that even a 10-minute walk after a meal meaningfully reduces the blood sugar spike that follows, compared to simply sitting. Often the real difference between two people who look similar on paper comes down to this. One moves constantly throughout the day, the other is active only in short bursts. Ninth, sleep, an area that doesn't get nearly the attention it deserves. When you're sleep deprived, particularly if you're regularly getting under 6 or 7 hours, your stress hormone levels rise, your insulin sensitivity drops, and your fasting blood sugar climbs. In one well-known study, healthy young adults restricted to just 4 hours of sleep a night for 6 consecutive nights developed insulin resistance comparable to early-stage diabetes within a single week. Other research confirms that chronic sleep restriction raises this marker even when diet is held completely constant. You could be eating well and exercising diligently, and poor sleep alone can undo much of that progress. 7 to 8 hours isn't a luxury here. It's foundational. 10th, alcohol deserves direct attention. Your liver treats alcohol breakdown as an urgent priority, effectively pausing its normal glucose-regulating duties to deal with it first. Over time, that raises liver fat, disrupts insulin signaling, and increases triglycerides. An occasional drink isn't a catastrophe, but if you're drinking regularly, even something as modest as a couple of beers most evenings, and wondering why your numbers won't budge, this is worth examining honestly. 11th, visceral fat deserves its own mention beyond what's already been said, because it's genuinely that important. This isn't passive stored energy. It's biologically active tissue that releases inflammatory signals, drives insulin resistance directly, and correlates strongly with this marker. You can't spot reduce it through targeted exercises, but as your overall metabolic health improves through the other changes on this list, visceral fat tends to be mobilized preferentially. It shrinks first. 12th, chronic stress. People tend to think of stress as purely psychological, but it's biochemical too. Sustained elevation of stress hormones causes your liver to release stored glucose into your bloodstream, drives insulin resistance at the cellular level, and shows up measurably in your blood work. I've seen patients doing everything right with food and exercise, yet their numbers remain stubbornly high. And once you dig into their daily life, chronic unmanaged stress is often sitting at the center of it. This deserves to be treated as seriously as diet or exercise, not dismissed as a soft or secondary factor. 13th, time-restricted eating, sometimes called intermittent fasting. This works beautifully for some people and is entirely unnecessary for others. The strongest evidence favors eating earlier in the day and avoiding food late into the evening. Research shows this pattern improves insulin sensitivity and even lowers blood pressure, independent of weight loss, likely because it aligns eating with your body's natural daily rhythm and reduces overnight sugar exposure. It's not a mandatory fix. If it fits naturally into your life, it can help. If it doesn't suit you, there are plenty of other effective levers to pull instead. 14th, replacing heavily processed foods with whole foods deserves its own spotlight, even though it echoes some earlier points. A landmark controlled study found that people eating a heavily processed diet consumed roughly 500 more calories a day and gained weight compared to those eating whole foods, even when both diets were matched for protein, fat, and carbohydrate content, and people could eat as much as they wanted. Processed foods are strongly linked to blood sugar disorders through several mechanisms. They spike blood sugar sharply, contain little fiber, satisfy hunger poorly, and often include additives that disrupt gut bacteria. Swapping these out for whole foods improves blood sugar stability, even without deliberately counting calories. 15th, and finally, medication. Lifestyle changes come first, always, but when those aren't enough on their own, medication isn't a failure. It's simply another tool. Certain long-established medications improve insulin sensitivity with a strong decades-long safety record and have been shown to meaningfully reduce diabetes-related complications. Newer classes of medication can lower this marker substantially while offering real cardiovascular benefits, and others work by increasing sugar excretion through the kidneys while also protecting heart and kidney function. These are tools to be used when appropriate, tailored to the individual, ideally working alongside lifestyle changes rather than replacing them. The reason this number responds so well to a multi-pronged approach is that it was never caused by one single problem in the first place. It's not something you fix with one pill or one supplement pushed by an ad online. It's the cumulative result of your insulin sensitivity, your muscle mass, the fat stored in your liver, how well you sleep, how your stress hormones behave, and the state of your gut. Pull several of these levers at once, and the effects compound. Your biology responds to steady consistency far more than to short bursts of extreme effort. You don't need to get everything perfect. You just need to keep most things moving in the right direction, patiently, over years. After a decade in emergency medicine, I can tell you this. I rarely admitted anyone to hospital with a normal reading on this marker. I admitted plenty of people with elevated readings, often already dealing with kidney failure, nerve damage, vision loss, heart disease, or stroke. What stays with you is knowing that at the earliest stages, so much of this is still reversible. Early stage changes can often be fully undone. Early type 2 diabetes can frequently be put into remission, but only if it's caught early. You have to act while the number is only mildly elevated, not wait until the damage has already arrived. Small, steady adjustments made consistently over 20 years can be the difference between growing older with freedom and independence, or growing older dependent on a long list of medications and other people's help.